platysmal bands.
And there they are.
And there you are. And for those who are not versed in the term platysmal bands, what this references are those lines and those bands that form in the neck when you try to grimace or make a funny-looking smile.
I think the best thing to do in most cases is to wedge out the portion that's, in the middle of the band itself, and then either do a little bit of a corset platysmoplasty. And so I like to sew that part together. I don't typically like to go below because I think that makes more of a cobra neck deformity.
Yeah, the cobra neck deformity being where you have this really kind of sunken in, hollow neck and prominent bands that still exist.
Yeah, it makes the bands worse.
Makes the bands worse. But not everybody needs a platysmoplasty. Some people just need to have the platysmal bands cut. As you mentioned, take a wedge out. If you just cut the bands, which it seems so obviously you have this big cord, you just cut it in half, it should go away. But as you referenced, it tends to grow back. So that's why most of us take a wedge, an actual little chunk of the muscle out. So theoretically, it doesn't grow back. And then you can choose to do the platysmoplasty, which is just sewing the muscles back together, as you referenced, just sort of at that superior aspect to sort of pull the chin and the neck up without creating that cobra deformity down low. Or you can choose to not. Some people don't need the platysmoplasty either.